probably noticed quite a boom in advertisements for direct-to-consumer genetic testing. This includes companies like 23andMe, Ancestry.com, Heritage DNA, and others. Now, these are tests that have been around for quite some time, but they're gaining a lot of attention lately. So, as a genetic counselor, I'm here to tell you what you need to know before sending off your spit. Ancestry testing essentially works by looking for different markers within our DNA that are associated with different ethnic populations from around the world. Now, most people who complete this kind of testing will have a variety of ethnic backgrounds, which usually leads to a pretty common question that I get, which is, how accurate is this testing really? And at the end of the day, these companies use different markers to determine someone's ancestry, and not to mention, it's really not an exact science, so although your result is probably pretty accurate, the results still might vary. While many of these companies advertise their ability to tell you about your ancestry information, some of these companies might offer some other services as well. One of these services includes a matching service that allows you to discover other genetic relatives that have also completed the same test. Now, some companies might also offer some additional information, like health information. 23andMe, for example, is now offering health information in regard to things like your carrier status for certain recessive genetic conditions, and your genetic risk for developing celiac disease, Parkinson's disease, and late-onset Alzheimer's disease, as well as some other conditions. Although this testing will only tell you if you have a higher risk of developing some of these conditions, it's important to keep in mind that not all of these conditions have effective treatment or prevention options at this point. These DNA tests for health purposes can only gauge whether or not your risk for a specific condition goes up or down. It cannot determine whether or not you are going to get that specific condition. And at the end of the day, DNA is just one piece of the puzzle that influences specific diseases. So it's important to consider that there are other factors like environmental factors, lifestyle factors, family history that oftentimes play a role in whether or not a disease is going to develop. So if you are interested in a more detailed risk assessment, consider talking to your physicians or your genetic counselors who can give you a more accurate risk assessment. As human beings, we are naturally curious about our genetic makeup. And as a genetic counselor, I certainly believe that we all have the right to our genetic information, just as long as we all understand the implications and limitations of this type of testing. If you received your DNA results and you're having a hard time understanding them, consider reaching out to your local genetics provider who can help interpret them. Genetic counseling is a service that is offered for all Ironwood patients. If you have questions, consider talking to your physician at Ironwood who can connect you with the appropriate resources.